Nurse Aide Skills Exam. Let's get started. When making a bed that is occupied by a client, the nurse aide should: Is it A, leave the bed in the lowest position? Or B, make the toe pleat? Could it be C, leave the bottom sheet untucked? Or lastly D, place soiled linens on the floor? The correct answer is B. Here is why. A toe pleat, a loose fold in the top sheet near the feet, provides room for the client's feet, preventing pressure and discomfort from tight sheets. The bed should be raised to a comfortable working height to prevent back strain on the aide. It is lowered when finished. The bottom sheet should be tucked securely, mitered corners, to prevent wrinkles that cause skin breakdown. Soiled linens should never be placed on the floor. They should be held away from the uniform and placed directly in a linen hamper. Next question. Frequent turning and repositioning of the client helps prevent: Is it A, cyanosis? Or B, indigestion? Could it be C, coronary disease? Or lastly D, pressure injuries? The correct answer is D. Here is why. Repositioning relieves prolonged pressure on bony prominences, which is the primary cause of pressure injuries, bed sores. Cyanosis, bluish skin, is related to oxygenation, not positioning. Indigestion is related to diet and digestion. Coronary disease is related to heart health, not directly to turning. Next question. When applying elastic stockings to the client, it would be best for the nurse aide to position the client. Is it A, lying down in bed? Or B, dangling the legs from the edge of the bed? Could it be C, standing at the side of the bed? Or lastly D, sitting in a wheelchair? The correct answer is A. Here is why. The client should be supine in bed before getting up. This ensures minimal swelling in the legs, making application easier and ensuring the stockings fit properly to promote venous return. Applying them while legs are dependent, dangling, or standing is difficult and less effective, as blood may have already pooled in the veins. Sitting in a wheelchair also presents the challenge of applying stockings to dependent legs. Next question. The nurse aide is in the employee dining room. A group of nurse aides are eating lunch together and begin discussing how rude a certain client was acting. The nurse aide should: Is it A, join in the conversation? Or B, suggest that this is not the place to discuss the client? Could it be C, be quiet and not say anything to the other nurse aides? Or lastly D, return to the unit and tell the client what was said? The correct answer is B. Here is why. This action professionally upholds confidentiality and reminds colleagues that client discussions should occur in private, appropriate settings. Joining the conversation violates client confidentiality. Remaining quiet condones the breach of privacy by not intervening. Returning to tell the client is a serious violation that would betray coworker trust and likely upset the client. Next question. The client's signaling device should be placed: Is it A, on the bed? Or B, within the client's reach? Could it be C, on the client's right side? Or lastly D, over the side rail? The correct answer is B. Here is why. Accessibility is the key principle. The client must be able to activate the call device independently to summon help. Simply placing it on the bed is vague. It could be out of reach. Placing it only on the right side is incorrect for a client with left-sided weakness or preference. Draping it over the side rail may put it out of reach if the rail is up. Next question. When helping a client who is recovering from a stroke to walk, the nurse aide should assist: Is it A, on the client's strong side? Or B, on the client's weak side? Could it be C, from behind the client? Or lastly D, with a wheelchair? The correct answer is B. Here is why. Assisting on the client's weak side provides the most support and stability where it is needed most, and it protects the weaker limb. Assisting on the strong side leaves the weak side unsupported and more likely to buckle. Assisting from behind does not allow the aide to provide support at the client's side where balance is controlled. Using a wheelchair is for transport, not for assisting with walking practice, ambulation. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.